According to the Centers for Disease Control and Prevention, CDC, about 7-8 people die every day from opioid overdoses, which is equivalent to a plane full of people crashing every week. Most deaths occur among people who take opioids following medical guidelines. I will share with you my experience with opioid. In 2018, my doctor prescribed me a painkiller to relieve post-surgical pain. A few days later, my friend handed me a full bottle of the same medication. I was supposed to take the drug for about 5 days, and I ended up having a 6-month supply. I was taking the medication for several reasons, such as helping me sleep. Unfortunately, I wasn't aware that the drug contained an opioid. Is it a crime to sell narcotics? Then why can doctors overprescribe them to encourage abuse and addiction? Opioids are very addictive, and when used frequently, patients can develop chemical and physical dependence. In some cases, like my case, prescribing opioids may not be the best practice. So why do doctors prescribe opioids often in such large quantities? Today, I will explain the reasons why doctors overprescribe opioids, then the consequences of overprescribing opioids, and finally, alternative treatment to opioids. First, let's talk about the reasons doctors overprescribe opioids. Kelly Denis, Associate Professor of Law, explained that opioid overprescribing occurs for 3 reasons. First, patients fool doctors to have a prescription. Second, through corrupt overprescribing when doctors place profit over best practice. And finally, doctors prescribe opioids in high quantities more than patient needs. As a result, patients use them for other disorders, such as depression and sleep. Or they give them to family and friends, just like my friend presented me with her leftover pills. Mark Yugan, a psychologist at Michigan University, said that this pattern of misuse can lead to addiction. Also, failing to dispose of leftover pills safely makes them available for recreational use. Scott Handland, a researcher at Boston Medical Center, says the pharmaceutical industry invests millions of dollars annually to increase prescribing rates. In addition, CNN and Harvard University researchers found that opioid manufacturers pay physicians to prescribe vast amounts of drugs. As a result, the US continues to lead the rest of the world in opioid prescribing and opioid overdoses. Now, let's talk about the consequences of overprescribing opioids. The opioid crisis started in 2000, when various organizations supported opioids in large doses for pain relief. The assumption was that opioids were highly effective and safe when prescribed by a physician. CNN reporters interviewed 2 women who found with opioid addiction. Kiara Balou said that she trusted her doctor and assumed that he was prescribing opioids because it was the best for her pain. Once I found out he was receiving payment from the pharmaceutical company, I thought, was it really my best interest? Or was it in his best interest? She said. I trust my doctor, Angela Cantoni said. But unfortunately, her doctor also received large sums from the pharmaceutical company. She said the drug helped her pain, but it left her in a zombie-like state. When doctors prescribe opioids, we may think they are harmless and safe. However, my experience and the experience of many others testify that opioids are very dangerous substances, and doctors should you offer alternatives before prescribing them? Now, let's learn about alternatives of treatment to reduce the prescription of opioids. Doctors should provide patients with alternative treatments before prescribing opioids, which could open an opportunity to combine traditional healthcare with alternative treatments such as relaxations, visualization, meditation, tai chi, yoga, and massage. Particularly, shift attention away from the pain by participating in something pleasurable, such as watching TV or listening to music, has proven helpful. Also, join group supports and receive individual counseling can assist individuals coping with pain. Take the example of Robert Curley, a truck driver who felt and hurt his back. For pain, his doctor prescribed opioid. In less than a year, Curley said he was addicted. After an overdose, he signed up for Kaiser Permanente Integrated Pain Service in Colorado. To cope with his pain, Curley begins his day with stretch, tai chi, and deep breathing. His word to others suffering from addiction and pain is, do whatsoever it takes to wake away from it, like no matter what, Curley says. Amanda Bai, a clinical psychologist at Kaiser Permanente, says the team helped patients with alternative techniques such as meditation, mindfulness, and exercises. Similar projects have been implemented in California. As a result, they showed a decrease in prescription pills per patient, said Kelly Pfeiffer, director at the California Healthcare Foundation. The strategy is to gradually decrease the number of opioid drugs patient takes before cutting them altogether. In addition, these programs work better when patients have access to alternative and complementary therapies as part of combined treatment. In conclusion, overprescribing opioids leads to misuse, addiction, and death by overdose. Also, pharmaceutical companies are paying doctors to prescribe large amounts of opioids. Opioids can be very addictive and should be only used responsibly. Before taking opioids, ask your doctor about other alternatives for pain management. As Diane Burke stated, people needed to know that taking pain medication to be productive and to sustain enriching relationships is very different than the disease of addiction, which limits one's ability to contribute to society and maintain healthy habits. Thanks.